will be discussing the cloud computing innovation in the perioperative care setting. Fragmented access to clinical data remains one of the most significant threats to patient safety in the perioperative setting. In my current clinical environment, anesthesia providers must open multiple systems, including the electronic healthcare record system, radiological imaging, lab values, and outside facility records to gather essential information before a case. This fragmentation directly leads to delays, incomplete assessments, and potential safety risks. In my research, I found that there's evidence that fragmented perioperative data contributes to workflow inefficiencies, increases clinical risk, and increases avoidable complications. A report from 2020 found that missing or delayed clinical information is linked to higher rates of medical errors and compromise patient safety. In a fast-paced operating room, every minute matters. When lab results, imaging, and past anesthesia histories are scattered across systems, anesthesia providers lose valuable time searching instead of preparing. As Mastrine and McCongle in our textbook emphasize, real-time access to accurate information is essential for safe anesthesia practice. Without it, providers operate with blind spots. So the purpose of my innovation is to address this major gap by creating a unified cloud-based clinical information system that brings all perioperative data into one accessible platform. A system-based approach to patient safety would define preventable harm as minimizing risk from the processes of care, which are intended to improve health. Emerging evidence indicates that the U.S. continues to face a widespread crisis of avoidable harm within the healthcare system. Alarmingly, more than 1 in 100 patients die within 30 days following a procedure, and mortality can rise to nearly 10% among those who experience postoperative complications. Procedure-related 30-day mortality now ranks as the third leading cause of death in the nation. Preventable harm persists for numerous reasons, including system-level failures, human factors, organizational culture challenges, and diagnostic errors. Here is a chart from RISE Apps, an electronic medical record software engineer system that highlights the key benefits of cloud computing in healthcare. Research consistently shows that outdated systems are one of the largest barriers to interoperability in healthcare. In 2022, reports have expressed that outdated on-premise servers lack the capacity to support real-time data exchange or lack advanced analytics. This shows that while solutions exist, they are either not comprehensive or they are not implemented at scale. My innovation builds upon these concepts but expands them into a unified perioperative cloud system that is specific. My innovation of a cloud-based integrated system would combine all patient data we normally toggle through while we were preparing for a case. It would be accessible on a computer and a mobile system, and it would include real-time alerts as well as predictive analytics. Imagine a system that would tell you in advance that this patient needed multiple pressor support during anesthesia for hemodynamic stability, or if this patient was a difficult airway requiring 2 anesthesia providers. This is key information. This innovation directly enhances nursing and APRN practice by reducing documentation burden because recent patient statistics and histories will be charted and incorporated into the chart. It will also improve perioperative and preoperative case preparation and enhance situational awareness, overall enhancing our decision-making quality. There are some financial implications. While there are short-term costs, evidence supports that overall there's a positive return on investment through improved productivity and reduced operational waste. In summary, fragmented clinical information significantly jeopardize perioperative efficiency and patient safety. The literature consistently supports the need for improved interoperability and real-time data integration. My innovation, a unified cloud-based system, addresses the root cause of the problem by enabling seamless access to labs, imaging, patient histories, and risk information through a single platform. The next steps include conducting a pilot implementation in one perioperative department. Also, evaluating workflow changes, time savings, and error reduction. Also, assessing provider satisfaction and usability, and expanding features such as predictive analytics for hemodynamic instability or airway difficulty. Future research should explore long-term cost savings, impact on clinical outcomes, and the integration of AI-based decision support within the cloud platform. Thank you.